Welcome. This informational is brought to you by the Sinha Clinic. It will discuss what you need to know about neurofeedback. Neurofeedback uses a specialized brain training program to retrain the brain to function optimally. It is non-invasive, requires no medication and is a cost-effective therapy. Results show long-lasting improvements in daily functioning for individuals with cognitive impairments and disorders. What areas of the brain can neurofeedback help? Anxiety, depression or mood disorders, brain injuries, learning and memory concerns, ADHD and autism. Basically anyone with a brain can improve cognitive functioning through neurofeedback. How does neurofeedback work? Neurofeedback trains brainwave patterns through auditory and/or visual stimulation in a video, ambient music, or video game. Neurofeedback works by a psychological process called operant conditioning. Our innovative neurofeedback program provides training criteria for the brain to recondition brainwave patterns through positive and negative reinforcement. Neurofeedback has many benefits. Positive improvements have been seen in students' academics and behavior in school and home. Improvements in memory, focus, attention and concentration. Adults noted better work performance, organization and time management. With additional benefits with sleep, anxiety, depression or other cognitive concerns. Side effects are minimal. The most common side effects are headache or fatigue during or immediately following a session. Patients are monitored very closely, so this should not occur regularly. Neurofeedback has been compared to strength training for the brain. Like physical exercise, if you have not used certain muscle groups regularly, you will be tired or sore. This is the body's way of telling you it is working. The first step is a QEEG brain map. A QEEG brain map is a specialized test that pinpoints the root cause of brainwave dysfunction and deregulation. We also use brain mapping to determine medication sensitivity for better medication management results. A QEEG brain map is simple. A clinician will place a brain cap on the head. Fill sensors with gel. Record brainwave patterns with eyes open and eyes closed. Neurofeedback protocol is determined by results of QEEG brain map and results discussed with patient. During a first neurofeedback session, a clinician will go over a brief patient history and discusses how neurofeedback works in more detail. Following the initial assessment, the fun begins. We pick a movie or video game and set up the patient for training. Sensors will be placed on the head. One on the left earlobe, one on the right earlobe, and one or two active sensors on the head at a particular brain site. The neurofeedback clinician connects sensors to an amplifier, and the patient begins training. The patient's brainwave patterns are relayed to the computer and recorded. A patient trains for approximately 60 minutes. 2 separate protocols are used. This is done 2 times per week minimum. The movie will fade in and out during the entire session to condition the brain with positive reinforcement. The sensors placed on the head measure the electrical patterns coming from the scalp. Much like a physician listens to your heart from the surface of your skin. No electrical current travels into the brain. Average amount of sessions are between 35 to 45 sessions. Neurofeedback training is designed to teach the patient to train brainwave patterns subconsciously. With continued feedback, coaching, and practice, the healthier brainwave patterns are maintained. Results are positive and long-term. Any questions? From all of us at the Sinha Clinic, we thank you for watching. Please contact us for any further questions at www.sinhaclinic.com.